Today, we are going to talk a little bit about the autonomic nervous system. We have already commented in passing about it in other classes, and now we're gonna understand a little bit better about how it works and how we can interact with it to have a better life. One of the main functions of the ANS is to perceive the environment, both the external environment and the internal environment of our bodies and minds, and to coordinate appropriate responses to each situation. It acts as the maestro of an orchestra, coordinating different organs and systems towards a single response. Many of the body's involuntary functions are influenced by the autonomic nervous system, such as breathing, heart rate, blood pressure, bowel movements, sphincters and excretory organs, sleep, blood vessels, skin, among others. Two of the divisions of the ANS are the sympathetic nervous system and the parasympathetic nervous system. The sympathetic arm of the ANS is mainly involved in flight or fight reactions. In other words, when the organism perceives unfavorable or adverse conditions and or some threats, an external threat, an internally perceived threat, the sympathetic arm, the sympathetic nervous system is more stimulated. Its action is to increase heart rate, to increase blood pressure, to inhibit the working of the gut and excretory organs, to mobilize energy sources so they are readily available for the heart, the lungs, the brain, and the muscles, and to have the person stay in a mental, psychic state of vigilance, of activity, of sensibility, of nervousness, so the person can react, because this arm of the ANS is concerned with survival, with response to some adverse condition or threat. On the other hand, the parasympathetic arm of the ANS acts grossly on the opposite line. It is most active in situations of relaxation, rest, and the perception of safety. Contexts associated with nutrition, feeding, maintenance, rest, and healing tend to have a greater intensity of activity of the parasympathetic arm of the ANS. Situations that are a bother or that pose as a threat of any level to the well-being of the individual, may it be physical or mental or emotional, may lead to greater activation of the sympathetic arm and lesser activation of the parasympathetic arm. This includes chronic organic conditions such as heart failure, kidney failure, asthma, cancer, Parkinson's diseases, and also mental health conditions such as stress, anxiety, depression, among others. And how do we know how this balance between sympathetic and parasympathetic arms of the ANS is doing on a particular person? There are several methods, but one of the most studied and easier to use is the heart rate variability, HRV. To summarize, the heart doesn't beat exactly in the same rhythm all the time as if it were a machine or a robot. Between each consecutive heartbeat, the speed is adjusted in milliseconds. So the interval between two beats change all the time. Heart beats, there's a time interval to the next one. From this to the next one, it's not the same time interval. It has been adjusted. It's a very specific fine-tuning. This ability to adjust the time between two consecutive heartbeats is what we call HRV. There are several different parameters that we can assess when we are interested in HRV. And overall, they let us know if HRV is higher, better, or lower, worse. Very grossly speaking. For the HRV to be higher, to be better, it depends on greater activation of the parasympathetic arm of the ANS. And overall, HRV mean better points that the person is in a better state of overall health. So, the activity of the parasympathetic arm of the ANS and by consequence the HRV are reduced in many chronic diseases. And the worse the situation of the HRV, the more serious the condition of that person. We have many different devices that measure HRV and its parameters. Smart belts, watches, rings, among others. As we said, the parasympathetic arm of the ANS has reduced action in context of illness and has a greater activation in moments of maintenance, of rest, of safety, of healing. So, it might be interesting to try and stimulate the parasympathetic arm to bring more balance between the two arms. And we actually have studies showing that this tactic works. We have several methods to provide this stimulus to the parasympathetic arm. Some are techniques that the person performs, others use devices specifically built for this. I find the techniques really nice because they are easy to learn, easy to do, they basically have no cost, and that makes it easier for more people to use and benefit from these techniques. The most studied techniques are techniques that have to do with breathing, specifically slower, rhythmic breathing. One of the most famous is diaphragmatic breathing, but we have several others. We have pranayamas from yoga. There are techniques from physiotherapy. There are many different techniques you can use. You don't necessarily need to use the HRV monitors to perform these techniques and benefit from them. These devices are very nice. They provide some very interesting information, but they are not necessarily. In everyday life, they are an extra. They can be used. They provide some nice information, but they are absolutely not a requirement to do these techniques. As we said, there are many different techniques, but studies show that when you're talking about stimulating the parasympathetic arm, what we are most interested in is that the breathing is slow and rhythmic. And to do that, you can use the technique that suits you best. And remember now, people, have some good sense. Every person is an individual case, so have common sense when you see things in the internet. Most studies show that healthy people, and even people with some very serious conditions, find these techniques very safe and most of the time useful. But if your case has some particular needs, or if you're in doubt if that is your situation, talk with your providers. Now let's quickly mention some situations or conditions where we have already seen some evidence of benefits with these breathing techniques. We have studies that see the effects on people with stress, depression, anxiety, back pain, asthma, to improve respiratory symptoms of COVID and long COVID, people with motion sickness, with gastroesophageal reflux disease, with urinary incontinence, with diabetes, to improve metabolism and digestion after a carbohydrate heavy meal, arterial hypertension, among others. Now you understand a little more about the autonomic nervous system, the sympathetic arm, the parasympathetic arm, HRV, breathing techniques, and why we mention them so often. That's it for today. I'll see you in the next one.